I'm Dr. Praveen. I am a surgeon practicing in Whitefield part of Bangalore. Day-to-day basis, I regularly see patients who present with constipation, problems secondary to constipation like hemorrhoids, fissure, and so on. And one of the common causes for constipation, hemorrhoids, and so on is the inadequate intake of fiber on a daily basis. So today I would like to speak about the importance of eating vegetables on a daily basis. What does a vegetable have, and why is so much importance given to fiber in order to prevent such health issues? What is fiber? Most of the vegetables and fruits that we eat contain fiber. Fiber is actually a complex carbohydrate. What is complex carbohydrate? Complex carbohydrates are the ones which cannot be easily digestible in the proximal part of the gastrointestinal tract, that is in the stomach or the small intestine. So these complex carbohydrates, also called as fiber, once ingested are not broken down in the stomach, neither the small intestine. It travels as it is to the distal part of the intestine called as large intestine. These fibers or complex carbohydrates are again of two types: soluble fiber and insoluble fiber. Insoluble fibers are the ones which add roughage to the diet. The soluble fibers are the ones which ultimately help us in giving nutrition to the colon. The soluble fibers, once it reaches the large intestine, are interestingly broken down by the commensal bacteria that we have in the large intestine. These commensal bacteria digest the fiber or the complex carbohydrates, and the outcome is the release of metabolites called as short chain fatty acids. Just like when you eat any carbohydrate, the ultimate output or ultimate result is the formation of glucose molecule, and glucose will help in energy production through ATP. Similarly, in the large intestine, the cells lining the large intestine called as colonocytes will basically use these short chain fatty acids produced as a sequelae of metabolism of these fibers by the commensal bacteria that we have, and these short chain fatty acids will help in nutrition of these colon cells. That is, these are utilized for energy by the colonocytes. So it is a symbiotic atmosphere between the bacteria and the colon. The fibers, once supplied to these bacteria will eat these fibers in a literal sense, and the byproduct is short chain fatty acids, and these short chain fatty acids are utilized for energy. If a colon cell is functioning properly, the colon in totality will function normally. The colon has got various functions, that is absorption of electrolytes like sodium and so on, absorption of water across its surface, the movement of the colon, that is peristalsis. So if these functions are not optimal, a person may land up in issues like constipation and so on. So to keep the colon in good shape, we need to eat adequate fiber on a daily basis. And remember, you are eating this fiber not for you, you are actually eating for these bacteria's sake, and these bacteria are actually helping you by breaking down those fibers into something which we can use for our own cells. So almost all the vegetables have got good amount of fiber. Around 100 grams of carrot will give you around roughly around 4 grams of fiber, and most of the vegetables that we have on a day-to-day basis have got an average of around 2 to 4 grams of fiber in 100 grams of vegetables. So a male is supposed to take around 30 to 40 grams of fiber per day, and a female around 25 to 30 grams of fiber per day. This is the recommended daily intake by many of the associations. What are the other benefits of the by eating vegetables? A vegetable not only gives these complex carbohydrates, but it also gives many of the phytonutrients. For example, one of the important phytonutrient called polyphenol is present in most of the colored vegetables and fruits. So the darker and the brighter color a vegetable or a fruit has, it is richly loaded with these polyphenols. These polyphenols have got immense health benefits. That is one reason. Second reason is these vegetables also gives us good quantity of vitamins that we need for our day-to-day function. It also contains minerals like zinc, magnesium, iron, and so on. So eating the vegetables on a day-to-day basis and in the required amount will give us the required quantity of all these essential minerals what we need. The other important thing that a vegetable will result in something called as postbiotic. So once the vegetables are digested, there is release of few gases, for example, hydrogen, methane, carbon dioxide, and these gases act as postbiotics, kind of neurotransmitters, and they will communicate to the brain as to the adequate intake of fiber. It is interesting to know that once a person takes adequate fiber, the release of these postbiotic gases sends a signal to the brain saying that this person has eaten adequate amount of fiber. So it gives a satiety signal to the brain telling that a person is full and has there is no need to eat anymore. The same satiety signal will not be reached by eating the similar quantity of carbohydrates, for example. So one can have a decreased craving for food if they take adequate fiber on a day-to-day basis. It thereby helps in preventing weight gain by eating a predominant carbohydrate diet. It will also help in losing weight if the intention of the person is to shed off some excess weight. If they restrict the amount of carbs they eat on a daily, and on the other hand increase the amount of vegetables. In fact, if you can fill half of your plate with vegetables, it will go a long way in helping you in losing the excess weight that you have. But the other question that we are asked is vegetables, should it be taken as raw or should we cook it? Most of the root vegetables, for example, carrot, radish, beetroot, they are best eaten in a raw form. So you can either grate it or you can juice it and then take it. The best way, of course, is the natural way of chewing these vegetables and then eating them slowly so that the digestion of these vegetables starts in the mouth. However, due to shortage of time, if one needs to take in a juice form, grinding them in a mixer and then taking will also be of help. Most of the vegetables, for example, cruciferous vegetables are a group of vegetables which includes broccoli, cabbage, collard, kale, and Brussels sprouts. So these vegetables are best eaten in a cooked form. Obviously, you shouldn't overcook them. They are best eaten in a steamed fashion. That is, you steam them in a cooker and then eat. They should not be over fried so that you don't denature the fiber that is present in these important vegetables. There are a lot of other benefits of eating the cruciferous vegetables, especially even for maintaining the hormonal homeostasis. These vegetables have a good role, especially in females. If a female takes adequate amount of these green leafy vegetables, both raw as well as cooked, it will help maintain the estrogen homeostasis in the body. So the estrogen metabolites which are produced in the liver and are excreted through the bile are essentially thrown out of the body once the metabolites attach to the fiber that we eat. So, if a person is not taking adequate fiber, obviously the estrogen metabolites, instead of being eliminated from the body, they will get recirculated in the body, which will result in something called as estrogen dominance and can result in many problems. For example, the pain during menstruation, it can result in polycystic ovarian disease, and so on. So, a female definitely needs to take vegetables on a day to day basis. The other common question asked is, why does someone have bloating or discomfort after eating vegetables? One important thing to note is that, is this person susceptible to such symptoms only since the recent past, or has he been having these symptoms since a long time, since childhood? Most of the time, these symptoms develop in adulthood. This is because of the improper diet practices, eating predominantly carbs, eating plenty of sugars, sedentary lifestyle, eating fried foods, and so on, which will result in the small intestinal bacterial overgrowth of bacteria which should be normally in less number. So, if there is small intestinal bacterial overgrowth, these carbohydrates, these complex carbohydrates, will be broken down in the proximal intestine itself, resulting in the formation of gas, the same gases that we had discussed a little earlier, like methane, hydrogen, and so on. And this will result in bloating, discomfort, tight tummy after eating vegetables. So, one needs to see a physician so that SIBO, small intestinal bacterial overgrowth, is treated, and after that one may tolerate these vegetables. So there are immense benefits of eating vegetables, and one should have, or one should make it a practice to eat these vegetables on a daily basis. An important tip that I can give is, if you can prepare a salad of raw vegetables in the morning, it makes it easier to have it and finish it by the end of the day. So you can grate it and keep it. You can mix carrot, radish, beetroot. You can add the spinach leaves. You can add cilantro. You can add lettuce leaves to this. You can in fact make it tastier by adding pomegranate, which is one of the richly colored fruits containing polyphenols that I have already mentioned. So make this tasty salad in the morning so that you will end up having the adequate amount of fibers during the day. The polyphenols that I had mentioned, I would like to add one more point. So these phytonutrients called polyphenols actually are important, and in fact pomegranate, to be very specific, will help in increasing the numbers of a beneficial bacteria called as Akkermansia muciniphila. This is a mucus producing bacteria which thrives in the mucus layer of the colon. So if we have a thick mucus barrier in our colon, it will help us in protecting ourselves from the unhealthy bacteria, protecting ourselves from the toxins that we ingest on a day-to-day basis. So eating these polyphenols in the form of these richly colored fruits and vegetables will keep the numbers of these beneficial bacteria in a sizable number, and this will help us in a long way in maintaining an adequate health. Thank you for listening to me. I hope you will put these practices, you will include these tips in your day-to-day basis. Thank you. Thanks again for patient hearing.